The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, restoring mouths and rebuilding smiles. With us, we have two board-certified prosthodontists, Dr. Seaman and Dr. Wiley. So pleasure to have you on the show. We've had you on before, and we've talked off camera. You say that we have a very unique practice. What makes you unique?
Well, a prosthodontic specialty practice, we don't get the patients that are just routine. General practitioner practice, most of the time, they're hygiene, maintenance, and they're more tooth-oriented. We have to look and rebuild the whole mouth and the whole image for the patient.
I've been told that a prosthodontist also is the true cosmetic dentist.
Well, in our
is that fair to say?
Yeah.
It's a big part of what we do is also restoring the smile.
Because you're doing dental implants. I mean,
right.
So who is the typical patient, by the way, that you see? Is there a typical patient?
A typical patient is one that comes in and they have multiple different needs in their mouth, and they're watching a decline of their dental quality and their comfort in their mouth. And so also with their smile, they're noticing they're smiling less and hiding their teeth more.
They could be missing teeth. The teeth could be eroding away or wearing away. You know, our population they're keeping their teeth longer, and that means teeth are being subjected to more wear and erosion, and now they've lost their smile. They've lost their function. The bite's collapsing.
Okay. And many of them think that nothing can be done.
Do they really say that to you?
They do.
Oh, absolutely. I mean, some are in tears. We literally have a Kleenex box.
Is that right?
As they start talking, they'll cry.
About their teeth?
Yeah. And one of the things I wanted to bring up about what makes our practice unique is as Frank said, they come in with multiple needs. That means they may be missing teeth, they may be missing bone, missing tissue, their smile, facial pain. And what we have to do is we have to be the quarterback. Okay. We have to organize this treatment plan that has been mutually accepted and organized how the surgeons are going to help us. They may need root canals. Frank's going to show a case on where we actually had to use orthodontics on an adult to get teeth back in the right place.
Okay, let's start with dental implants, just a single tooth.
Sure.
And what are the age ranges, by the way? How young could you be?
Well, actually, I'll show you that case right here, Randy. He's only 15 and a half years old. Normally, and this is a male, we used to do this when they were about 18. And female patients, we would do at 16. But we found with the downward and forward growth, delayed growth that a lot of these younger patients have, the bone and tissues come down and the teeth come down, but the implant doesn't. So we have to delay that. And a lot of these patients just will not put up with an orthodontic flipper type retainer. We now have the ability with one of our ceramic products to literally, without having to cut on the adjacent teeth, we can make an all ceramic bonded restoration, which actually is a permanent restoration and can last them 3, 4, 5, 6 years until they can get an implant done. A more common type patient is, this may not look very complicated to the average person, missing one tooth, but look at how much bone height and width this patient has lost. Just trying to put a tooth in there would look fake.
So when a tooth is missing, the bone goes away.
Yeah, you can lose up to 50% of the width from the lip to the palate with just the extraction of a tooth, unless we work with a surgeon that can help restore that or rebuild it. Okay. In this case right here, people like to have something right away as often as possible. The surgeon, we made our radiographs, we could put an implant in here. So not only did we put the implant in, the surgeon wanted me to develop a form of root and tooth as it comes out of the gum right at the day of the implant's placed. So I made a provisional restoration, and it has to stay where they can't bite on it, but it gives them some looks. And look what we were able to do in just several months. We were able to give this patient back the volume and the aesthetic scalloping for this. And what I always tell the patients is that the implant is the root, and we're going to make you a new tooth which screws onto the implant right here. And then we also did a veneer on the other tooth. And look, you cannot tell which one of those. If you didn't see this picture, and this is a 5-year follow-up, it's just remarkable. But this is not a one-day procedure. This took us probably 5, 6 months to develop, to put the implant in. The surgeon, and we use a periodontal surgeon more often than not, because they really work with the tissues well.
I'd like to point out one thing on that last picture there, Mike, is on the picture with the teeth. It's our job as restorative dentists to go ahead and make that artificial tooth substance, porcelain, look like it's emerging out of the natural bone, like it's a natural.
So you can have a dental implant even in the front and make it look natural.
Right.
Absolutely.
Right.
Okay. Now, when I see advertising and things like that, where you go in, you get your teeth right then and there, in one day, or in 1 hour, or at lunchtime, or whatever. You smile. We've talked a little bit off. You said maybe a little bit of an exaggeration.
Yes.
It's being oversold. What do you want? What do you need the public, or what should the public know about things like that?
Well, really, that's just a temporary restoration. It needs to be replaced at some point in time. Depends on what the situation is. One implant, one tooth, or all of the full arch, and it can last up to 6 to 12 months. And so at that point, something more long-term needs to be discussed and finalized.
Right. Frank's got a couple really good cases that's going to show in just a couple minutes on that.
So whether it's one tooth, then what about multiple teeth?
A much more common patient, people that are missing 1, 2, 3, or 4, 5, 6 teeth up front. And we really want to be able to give them options, because good old conventional prosthetic dentistry still holds. Here's a lady who over years has lost a tremendous amount of bone and tissue. And if we just, right here, if we just put single crowns on implants, her lip would be sunken in. So with a removable prosthesis, a partial denture, one that is removable, snaps in, we placed 2 implants, but look at how much volume we had to regenerate for this patient, so that when she smiled, she has a natural looking smile.
It is very nice.
And even those
they don't look like dentures.
No, and actually, the old saying is, when I talk to patients, these aren't your grandma and grandpa's dentures that we make these days. So this is a more conventional.
What do you call it? Do you call it a cosmetic denture?
Oh, it's just a removable partial denture.
It's a custom denture. We are replacing
absolutely.
both the teeth and also the tissue, the gum tissue, for
All
facial support. We need to arrange the teeth also so they look most natural and most aesthetic.
And this doesn't involve just sending something to the lab and get something back. We have aesthetic try-ins. They get to see this in wax, or we can customize the teeth.
It's so exciting.
And we have a full open catalog where they can select from probably 30, 40 different shapes and contours.
Okay.
Another example is, this is a more conventional type, what used to be done before we had implants. The patient is missing the 2 front teeth, but has 2 really strong adjacent teeth. Okay. She did not want implants, but she did allow us, remember how in that first case I showed how the bone had sunken and everything else? Okay. This patient allowed us, from the time the teeth were taken out, for the surgeon to rebuild the socket, hold it, and then I was able to make a temporary restoration. And look at the scalloping on there. It looks like you can just see where teeth came out of there. Okay. And by doing that,
that was all planned out.
Oh, absolutely.
Right.
And this
just
is all part of our
happen.
and I show this. This is sort of the bottom side to show you one of the different types of restorations that people are asking for. A lot of people don't want metal in their mouth.
So there's no metal on that.
There's no metal.
Right.
This is their
Metal-free
coning
dentistry.
framework. And our ceramist customizes and veneers it with the real shiny enamel porcelains. And look, now we have a bridge that's coming out of the tissue, not laying on top of it.
Very nice.
Right.
Yeah.
Remarkable.
Now, here's a situation. Danny, she's a med student on the East Coast, sees us during the summers. She had a athletic accident.
Is it painful, by the way? I mean, do the patients complain about pain? It seems awfully painful.
Pain is not a comment that all of our patients ever make.
So in the front, so these are implants in the front.
Right.
And they're matched
I mean,
up
she
like
can
this.
eat apples. And the other thing that we haven't mentioned is that not only is our specialty involved with replacing what's missing, tooth structure, we want to preserve what remains. And implants help stimulate the bone from inside and keep that bone tall, volume, and it's helping her for the rest of her life.
You love this stuff. You guys like this stuff.
I'm telling you, what it does. I remember in dental school we used to joke, boy, I'd love to screw this denture in. I just can't keep it in place. Well, we can do that now.
Really?
Absolutely.
So it's, I mean, no more dentures for the most part. I mean, in the future.
Well,
the way we
there'll
think
still
of
be
dentures now,
dentures, but Frank's
snap
going to
in,
show you
snap
some
out.
cases
Okay.
that
There'll
really
be
work well.
implant-supported dentures.
Got it. Okay.
The last case before we move into more complex cases, here's a lady who's missing 4 teeth. She says, yes, I want implants, but she doesn't want to have an implant per tooth because we wouldn't be able to have what looks like tissue, papillas, in between the teeth. So what we like to do now is we like to put 2 implants in, just like we did on that one bridge. But she was missing a lot of tissue and did not want to do the bone regeneration and tissue. So what we could do on her is we can literally make a bridge right here that replaces the missing tissue with pink porcelain and a substructure and make each tooth look individual, and then that is literally cemented into place. She can eat apples, she has her smile.
Supported by a dental implant.
Absolutely.
Right.
Okay. Very attractive lady. She got her smile back, used to model. She's going back to modeling.
All right.
All right.
Okay, so Dr. Seaman, your photos. What are we looking at over there?
For this gentleman, really, he's a young man, came in with multiple teeth problems, had a lot of teeth sensitivity, a lot of pain, facial pain, and he really had an acid reflux problem, which dissolved away all of his teeth. You can see the severe teeth erosion, and so for this gentleman, what we really ended up doing was putting porcelain crowns on all of his teeth and restoring his smile. You can see that we get really into setting it with the lip line, the lip balance, and also individualizing each tooth and make it look most natural, each one
and
by
because
itself.
it's, so even if his acid reflux comes again, the fact that it's porcelain, it's really not going to wear on it.
Right.
Is that right?
Correct. Very wear resistant and erosion resistant.
And they don't really stain because it's made
Right.
of glass, right? Porcelain.
Right. And so we really changed his life for him. He has the rest of his life to appreciate the value that he's invested in his mouth and his teeth there. And so we've helped him out quite a bit. This young lady, the same kind of basic thing. A lot of teeth wear, a lot of teeth pain, and grinding her teeth also. And she's now watching the dental decline of her mouth occur. A lot of pain, wearing, and
so she comes to you because why? She has pain, like TMJ pain?
Well, she wants to keep her teeth.
All
She's young, and she knows they're wearing out. She's just cracked off 2 teeth recently. One of her front teeth she just cracked off. And so she wants to reverse the course of her dental decline.
All right.
And so she sought us out to see what we could do for her. And really, we made a good diagnosis and stabilized her bite and lined her teeth up really well. And ended up really removing the cracked teeth for her. One of the front teeth here is really an dental implant restoration for her. I'll show you that closer up here with this picture here.
Look at this result. Find the tooth that has the that's an implant.
Can't tell which one.
Right. With dental implants in proper teamwork and in planning to plan it all out, it's not really easy dentistry. It takes a lot of thoughtful consideration. And so really this middle tooth right here is the dental implant.
Interesting.
And we can make it look like it's emerging from the gum line, just like the other teeth, and keep the balance of the projection of the tooth in place in line with the other teeth there. So what we can do with dental materials and also with dental implants is just remarkable. So that's what's
So you're training
exciting.
as a prosthodontist. I mean, this is really what you do.
Right.
Right.
Is that right?
Correct.
Now, does somebody need a referral to see a specialist like you from their general dentist? Can they call you directly?
Oh, they can
I mean, I
call
know
us
you
directly.
get referrals.
When we get a referral from another dentist, we know that the patient has been prepped for what they're, most of the time prepped for what they need. But we do get from referrals from shows like this and our patients, and we really need to start from ground zero with them.
I'm always surprised because we've talked and you say that a lot of the patients, they've seen you on TV or they've heard from a friend. A lot of people don't know that anything could be done. And I'm surprised by that.
Right. It's
I mean,
so,
did they tell you that?
They do. It's so revealing to have them realize for the first time that really things can be done. We need to figure out what their basic treatment needs are and what their desires are, 2 different things, and then match multiple different treatment options that we're capable of providing for them and find an option that's going to work for them, and then press on.
Now that guy
this next case is really, this is going to show you how we really use an entire team.
Right. This gentleman came up from New Mexico up to Colorado for us here, and he was mid-treatment of some pretty advanced, extensive dentistry, and it wasn't quite going along the path that he wanted it to, and so he really sought a second opinion.
They were going to take all his teeth out or something like that?
Well, they gave him, he had a collapsed bite, and because of it missing back teeth, he had all of his front teeth begin to flare out. And so they gave him dental implants in the back.
So
part
if
of
you're
his
missing
mouth.
teeth in the back,
Right.
it forces the teeth to
you
move forward a little
just
bit?
start hitting the front teeth only, and the front teeth aren't made to be grinders. They're made to be scissors and for
Interesting.
speech. And so, boom, they'll just flare out right
The
out of the
back
mouth.
teeth help to protect the front teeth.
So you stop that by getting some implants
Right.
in the back or filling in those spots. So with him, those teeth had to go?
Well, for this gentleman, that's what he was told. He said, okay, we got your back implants in, and now we need to pull out your front teeth. He said, he didn't tell me that at the beginning, and so he said, really, I'd like to keep my teeth, thank you. And so he came up to us, and we made the diagnosis that really he had a collapsed bite, and they restored the back implants. He had a closed down bite, and his front teeth are all flared out still. So really, to treat him properly, we needed to remove the implant restorations, build up his bite more, and bring these front teeth back in more. You can see how they're all
With
tipped out.
orthodontics.
With orthodontics. And so we can use the existing implants and use them for anchors to help pull those teeth back in. Get them lined up properly, and it's very routine at that stage for us to go ahead and restore the front teeth and also restore the implants to give him a good solid bite and give him back the smile that he always wanted.
You know, this goes back to when I was talking about that first hour that we spend another hour or two in the lab after that with that articulator that simulates the mouth movement, and between us and the lab technicians, we wax up or place teeth where they need to be to support in relation to this joint. It's very important. I mean, anybody can put crowns in, but to get it to where it supports the joint and the muscles are happy, now he or she is not going to be able to beat up those teeth.
It's all in a lot of function, a lot of force going on in the mouth, a lot of bite force, and so that's one thing we deal with all of the time is giving enough strength to deal with their particular bite force.
Okay.
Like talking about bite forces, people with dentures don't have the adequate teeth root support. They can only bite 1/6 the pressure of people with natural teeth, so they've lost a lot of
They're
bite
down
force.
to only 50 pounds per square inch, whereas the three of us here could easily generate 500-600 pounds per square inch of biting force. And you tell somebody that
So with
hits them.
denture wearers, I mean, are they actually chewing or I mean, they're just kind of like a
They're-
cow, right?
right,
In
they're
a
kind
way,
of
they're not
trying to-
really.
It's a glorified gumming. It's really
Is that right?
bad.
Okay.
Once you slip in some implants on those dentures, it's remarkable how
Give them
much
something
it improves
snap in,
their,
snap out.
how solid their bite is, and how comfortable their jaw support really feels. And they feel so much better about themselves. Such like with this lady here. She lost also all of her back teeth here, and she has too much pressure on the front teeth. Bite collapse again, and she knows something needs to be done, and she's willing to have her front teeth removed. And we came up with this end result for her. I'll show you how we got here. Isn't that remarkable what we can do with,
Very nice.
with these kind of cases here like this? And we can design out their smile. Look at her lip balance here versus how much she shows with lip
Yes.
here with the smile. She feels so much better about herself here.
They
Here she's
strain to
reserved.
get even a remote smile. We force them. We
Right.
almost
Really?
have to punch them in the
Right,
ribs.
right. Say,
But look
"Please
how
smile."
natural that is. That's
Yeah,
amazing.
it's very nice.
Yeah.
It's a youthful look
Yes.
as
Right,
well.
right.
So those teeth had to go. She was told
Right.
somewhere else.
She was
teeth have to
prepared.
go.
Right.
Dentures or dental implants.
Right.
And she picked dental.
And she picked dental implants, and so we had to do site preparation and develop the bone first. Very important to get a good bone foundation to place your implants in. If you place implants in inadequate or not enough bone, weak bone, they're gonna collapse. Is basic engineering principles.
Okay.
So for her, we had to reconstitute the bone, place the implants in, and then this also shows her treatment. What we did. She has 6 upper implants in the upper jawbone there, and we made a gold bar between to help splint the implants and form as an anchor for the teeth to snap into. So that's a snap-in
So that's
denture.
like the underside of a denture, right?
Exactly,
Right.
right.
And
The
it
gold
just
clips
snaps
that
in.
snap right in.
And so in the mouth,
She can eat whatever she wants
She
with that?
can eat. She has her bite back. She has her smile back, and it's a very long-term restoration like that. So she's ecstatic with the
You know,
results.
the other thing that we do is we believe in long-term maintenance for the patients, because some of these people will do some work and kind of let them go off.
Right.
We bring them back in. Now just think about this. If there is a problem with that denture, often we can, if a clip breaks or a tooth breaks or anything like that, our in-house lab can fix that in 45 minutes to an hour at a minimal cost to the patient. So, and cleaning, it's so much easier to clean this, take the denture out. It's not grandma and grandpa's old dentures.
And the roof of the mouth is not covered.
No,
Like
look
a
at
regular
that.
denture.
It's left open so they
Speech,
get
taste, not affected. They love it.
right.
Okay.
Now, I just need to say one thing,
sure.
is that there are there's some advertising out there for groups that are saying that, boy, you can go in and you can get all your teeth and all your implants, no grafting in the same day.
Okay.
They're not telling the whole story.
All
It
right.
lasts for 6 to 12 months, you know.
This is a good case to demonstrate
I'll
that.
show.
Okay, let's
I'll
take a
show.
look at this.
This
Perfect
lady,
lead in
right.
here.
This lady came in and she had a failing upper partial, all of her back teeth missing again, bite collapse, front teeth are failing. She knows that she has a bad mouth. The partial denture is flopping around and she really doesn't like it anymore and wants something else done. And so with dental implants, we can restore the strong bite that she once had at one time and also restore her front teeth here. So this is really before and after. I'll show you how we got
Now, are those
there.
fixed in her mouth, or
these
it
are,
comes in, comes out?
These are the kind that come in, come out. They snap
Okay.
in and snap out. We did have a fixed variety in there for a temporary device for a period of time. I'll show you. So the fixed variety, Randy, these teeth are really literally screwed into the implants the same day that the implants are placed into the bone by our surgeon. And so it's only really a temporary device. It lasts 6 to 12 months before breakage starts to occur. They can't clean this real thoroughly, effectively underneath this framework here. So we went 3 years with her, and then we started to realize the breakdown of the temporary restoration. At that point, we needed to move on to the more long-term teeth replacement for her. So also the gums, you can see here, the gums start to shrink back from this. If this were a permanent thing, that would lead to long-term problems for her. Plus, she can't clean effectively. So for her, we went to the more long-term approach with her and made her the clip-in teeth that fit on, use the same implants. The implants are still good. Just change the substructure support system to a bar clip.
So that
variety.
bar is really necessary then,
Oh,
for
yes.
long term.
Right.
Yeah.
There are different
Interesting.
varieties of attachment studs and devices, and this is just one that works super well.
Now,
for
you know, our
patients.
show airs throughout the U.S. and Canada, and I've had other dentists on the show talking about these procedures,
Right.
where you just have 4 and things like that. Are you saying that what's being left out is that it's really just a temporary situation?
Right.
Is that right? Most of the time?
Some of the ones that they put everything in, try to do everything at one time.
Yes.
The accuracy in which these abutments have to fit on top of the implant, even with the computer CAD/CAM technology, they could be off by a 0.5 millimeter to 1.5 millimeters. In an implant dentistry, that's not acceptable. So we then, after they've been able to wear it, can go in and take very precise impressions and give them something that I'm going to show here in just a second.
Okay.
Randy, here's another patient that came in, and really she's been searching for dental treatment to help her with her problem for 20 years and never reached an acceptable treatment solution for her treatment needs. She has severe teeth sensitivity, horrendous bad bite, and really she
So those
just...
teeth actually had to go in that particular
Right.
case?
They had a lot of
nothing can be
decay.
done.
Nothing can be done, and she is fully aware of that.
Was she ashamed of her smile?
She didn't like how they projected, and that made her try to hide her smile quite a bit. She's a very attractive lady. We restored her over here. We had
Very
all of her
nice.
teeth surgically removed by a surgeon, and we allowed for healing to deal with a stable gum base, and we opted to make her just conventional dentures in this case here.
Okay.
We offered implants, and she wasn't quite there yet for that treatment option. We can always come back later now and retrofit implants to her existing dentures. So
All right.
that's still an open treatment option for her if she wants increased bite support. But for her, treating her needs, she's out of pain, and she looks a ton
Looks good.
better. Looks great.
Well, this is a great segue to the last little thing that we want to show. You know, people are getting online now, they're self-diagnosing, they're very much more aware of what the options are. And you have people that they don't want a denture, whether it's snapped in, screwed in, they don't want it. They want good old crown and bridge, and they want it all.
Solid material.
Solid material. And here's a case. We were able, by, again, engineering, working with the surgeon, selectively taking out teeth, grafting, we were able to get 16 implants in, 8 in the upper, 8 in the lower, and do good old American crown and bridge.
So that's like getting your teeth back.
It is.
And that
And he, if you
Exactly.
look at this right here, they look like they're coming right out of the tissue. This picture is 10 years old. We did this case in 1998 and 99 is when we finished it. He lives in Arizona, but he comes back to us. And the last little thing, because we are, like I said, we're kind of high touch, but we're also very high tech. Here's a patient that was in a major accident back in the 80s. The University of Kentucky's dental school rebuilt her, but they did technology at that time that was all was there, and it was denture teeth processed on to a metal bar, and they yellow, they break off.
Wow.
And so what we were able to do is we're able to design new substructure to replace all that missing bone and tissue like we did in that little small bridge, but we can do it over the whole mouth. And if you look, we have little V's where they can go in and floss, and then give this patient back something that they haven't had for over 20, 25 years.
So no matter, you know, and we are just about out of time. You know, at the top of the show we said rebuilding mouths. So these people, they come to you, and these are big messes. I mean, their mouths a mess.
They're complicated.
So no matter how far gone, there's always something that can be done.
Exactly. There's always something we can do.
We haven't met that, knock on wood, we haven't met a patient that we can't give them back what they've been missing for a while.
People are always asking me, you know, who should I go to? And we try not to refer people, and this is a real interview.
Right.
I'm not endorsing you on the show,
Right.
but I do say go to a specialist if you have the opportunity.
You're going to get more bang for the buck.
Yeah.
Okay. So final message. Somebody watching this, and they know their mouth's a mess. Maybe they don't know anything can be done. What do you say to them?
Okay, there's always something that can be done. There's no reason to think that they're going to live in despair because of their teeth the rest of their life. Come on in, we can take a look, and we can help them make an informed, good decision. They need to be fully educated about what the problems are in the different treatments out there, that's all. It's great value though. The sooner they get started with the process, the more life they have to enjoy their teeth and get a good solid bite back again, and also a great smile.
Dr. Wiley?
If you're seeking treatment and all you're getting is one option, get a second opinion, because there's always more than one way to do something. And I think that's one of the things that really is sort of our little market in the area.
We work with our patients.
All right. I want to thank both of you for coming on the show.
Thanks, Randy.
Thank you, Randy.
Hot topic. All of these photos can be also found on your website.
Right.
Yeah, we're putting a vast majority of this stuff on there.
Okay. Well, thank you guys for coming on the show. Very interesting.
Thank you, Randy.
Thanks,
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can see it again on wellnesshour.com. Just put in Dr. Wiley or Dr. Seaman. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.